Preventing surgical site infections, SSIs, in the operating theater is critical for patient safety and optimal outcomes. SSIs are one of the most common healthcare associated infections and can lead to significant morbidity and mortality. Here are detailed safety measures to minimize the risk of SSIs. 1. Preoperative measures. Patient preparation. Preoperative bathing. Encourage patients to bathe or shower using an antiseptic agent, such as chlorhexidine, the night before or the day of surgery. Hair removal. Avoid shaving the surgical site. If hair removal is necessary, use clippers immediately before surgery to prevent microabrasions. Screening for infections. Screen and treat pre-existing infections, such as MRSA colonization, using appropriate decolonization protocols, e.g. intranasal mupirocin and chlorhexidine washes. Glucose control. For diabetic patients, maintain tight glucose control before surgery to enhance wound healing and reduce infection risk. Antibiotic prophylaxis. Administer prophylactic antibiotics within 60 minutes prior to the surgical incision, ensuring they are appropriate for the procedure and pathogen spectrum. Repeat dosing during prolonged surgeries or in cases of excessive blood loss. 2. Intraoperative measures. Sterile environment. Proper ventilation. Use laminar airflow and maintain positive air pressure in the operating theater to reduce airborne contaminants. Restricted traffic. Limit personnel movement and door openings during surgery to reduce microbial contamination. Sterilization of instruments. Ensure all surgical instruments and devices are properly sterilized and free from contaminants. Hand hygiene and personal protective equipment. Hand scrubbing. Perform a thorough surgical hand scrub with antiseptic soap or alcohol-based hand rub before donning sterile gloves. Appropriate PPE. All surgical team members should wear sterile gowns, gloves, masks, and caps to minimize contamination. Aseptic technique. Adhere strictly to aseptic practices during all aspects of the procedure. Avoid unnecessary contact with the sterile field and maintain the sterility of the surgical site. Surgical technique. Minimize tissue trauma by using gentle handling techniques and electrosurgical tools appropriately. Ensure meticulous hemostasis and of leaving foreign materials, e.g. gauze, in the surgical site. Use wound irrigation with sterile solutions as necessary. 3. Postoperative measures. Wound care. Apply sterile dressings immediately post-surgery to protect the wound. Educate patients on proper wound care and signs of infection to ensure timely intervention if needed. Antibiotic stewardship. Avoid prolonged use of antibiotics unless specifically indicated to prevent resistance and reduce adverse effects. Monitoring. Monitor for early signs of infection and address them promptly. Conduct postoperative follow-ups to assess wound healing and address complications. Training and compliance. Staff education. Regularly train staff on infection control protocols and updates in SSI prevention. Audits and feedback. Conduct periodic audits of compliance with sterilization, hand hygiene, and antibiotic protocols, providing feedback to improve practices. 5. Environmental controls. Regularly clean and disinfect operating theaters with approved disinfectants, focusing on high-touch surfaces and equipment. Maintain humidity and temperature within recommended ranges to minimize bacterial growth. Implementing these measures as part of a multidisciplinary approach significantly reduces the risk of SSIs, ensuring better patient outcomes and improved overall surgical safety.